Good morning, everybody. Yesterday, 121,000 people in New South Wales came forward to get vaccinated, and we passed, as we predicted, that 7 million jab mark, which is outstanding. In the 24 hours to 8 p.m. last night, there were 1,288 cases of community transmission. Unfortunately, there were 7 deaths, and we extend our deepest condolences to the family and loved ones of those people who lost their lives. And Dr. Chant will provide further details. But it's really important to note that I've been commenting in the last few days that we anticipate October will be the worst month for the number of people that lose their lives, and also for the rate of people in hospital. And if I can just briefly explain that it's normally in the second week of illness that people get very sick. So there's always a lag between when people get diagnosed and when they're likely to need intensive care or hospitalisation. And obviously, as the rate of vaccination increases, as more and more people are vaccinated and have that protection, we will see that rate of hospitalisation come down. But a number of people, unfortunately, who've lost their lives have not received any dose of vaccine. And I hope that changes into the future to make sure that everybody who has access to a vaccine chooses to take the vaccine to prevent ICU and to prevent hospitalisation. Pleasingly today, New South Wales looks like will be the first state or territory to hit 70% first dose vaccination across our population, and I just can't thank our people enough. It's been a really difficult couple of months, and the fact that people have heard the messages we've been giving and coming forward to get vaccinated and hitting that 70% first dose is an outstanding achievement. As a result, can I say that all those people who live in local government areas of concern from 5 o'clock tomorrow morning will be able to have unlimited exercise. So previously we'd only allowed them an hour a day to exercise, and now the public health experts have given us the green light to allow everybody who lives in a local government area of concern unlimited exercise, which starts from 5 a.m. The curfew's still in place, but there'll be unlimited exercise from 5 a.m. to 9 p.m. And now that means that the exercise rule is the same for every person across New South Wales in terms of that ability. And again, especially to those citizens in our local government areas of concern, thank you for the extra effort you're going to. We're supporting you with extra vaccine, but also with extra support across many different areas of life to support you during these difficult times. I just wanted to also remind our citizens that 70% double dose will be different life to what we're experiencing today. 70% double dose vaccination will allow us to do those things we've all been missing. It will allow us to interact with one another safely. But again, I want to stress this. The privileges will extend to people at 70% double dose are only for those who are double vaccinated. So get vaccinated now. Make sure you've got those protections in place. And we're giving people plenty of notice. We anticipate we'll hit that rate around the middle of October, but I just want to stress to everybody, you have time now to go forward and get a vaccine. There is vaccine available, make a booking, and we look forward to everybody enjoying those privileges once we hit to 70% double dose vaccination. And I just can't thank everybody enough for the efforts you've gone to date. And whilst we know we are living in very challenging times, we always knew September and October would be our most difficult months. But once we get to those higher rates of vaccination, life will be and will feel very much different. And again, I stress that at 80% double dose vaccination, we anticipate allowing our citizens to access international travel and also to welcoming home Australians through Sydney Airport. And that is something we want to do on behalf of the nation, because during a pandemic, we can't pretend that we're separate nations within one nation. We all need to work together. New South Wales will support the national aim to stick to the plan, but also to welcome home as many Aussies as possible. I want to see as many Australians as possible across Australia, and those who are overseas join their loved ones here in Australia for a happy Christmas. Dr. Chant will now give her update. The Deputy Premier will talk about the regions, and then we'll take your questions. Thank you.
There were 1,288 locally acquired cases of COVID reported in New South Wales in the 24 hours to 8 p.m. last night, and there were no overseas acquired cases. Pleasingly, the testing rates are still maintaining at that high level of 127,428 tests. There's currently 160 people in intensive care and 64 of whom require ventilation. Sadly, we've been notified of 7 deaths of people who had COVID-19. A man in his 80s from southwestern Sydney died at Campbelltown Hospital, and he had underlying health conditions and wasn't vaccinated. A woman in her 80s from southwestern Sydney died at Liverpool Hospital. She was not vaccinated. A man in his 70s from southwestern Sydney died at Liverpool Hospital, and he acquired his infection at the hospital and is the 12th death linked to this outbreak. He had received both doses of a vaccination. He did have significant underlying conditions. A man in his 80s from Sydney's North Shore died at Hornsby Ku-ring-gai Hospital, and he acquired his infection at the hospital. He had received both doses of the vaccination, but he had significant underlying conditions. We've got a gentleman in his 50s from southwestern Sydney died at Royal North Shore Hospital. Again, he was not vaccinated and had underlying health conditions. There was a gentleman in his 80s from southwestern Sydney. He died at St George Hospital, and a woman in her 70s from southwestern Sydney who died at Campbelltown Hospital. Can I extend my deepest sympathy to the families of the loved ones. In terms of sewage detections, we have had some sewage detections in areas where we don't have cases, and that causes us a degree of concern. So in southern New South Wales, Bega and Cooma, and in Illawarra, Shoalhaven in Bomaderry. So please come and get tested if you have any symptoms and isolate until you receive a negative result. The areas of concern are Auburn, Guildford, Marylands, Greenacre, Bankstown, Punchbowl, Blacktown and Liverpool. But as I've repeatedly said, everyone has to be at risk. We are seeing cases increase in other areas and the other suburbs, and so it is important as we go about our daily requirements, please practice those COVID-safe behaviours. In terms of the Central Coast, there have been 7 new cases reported in the Central Coast, 8 p.m. last night, and 3 of those are linked to a previously notifiable case, but unfortunately all 7 were infectious in the community. There's also been some unlinked cases in the Central Coast that are raising concern. So people who live in or travel through areas like Lake Munamora, Sharm Haven, San Remo, Budgewoi, Lake Haven, Gorokan are asked to continue to maintain COVID-safe behaviours, and if anyone has symptoms, please get tested.
Good morning. I start by offering my deepest condolences to those families that lost loved ones, and you remain in our thoughts and prayers. Again, to 8 p.m. last night in the Far West Local Health District, there were 5 new cases, 4 in Wilcannia, 1 in Broken Hill. In the Western New South Wales Local Health District, there were 23 new cases, 18 in Dubbo, 4 in Orange and 1 in Brewarrina. And again, a call out to those communities to keep getting tested. It's where the concentration of the outbreak is in regional rural New South Wales, and really urging people to do so. In the Hunter, New England area, there were 4 new cases, 2 in Port Stephens local government area, 1 in the Lake Macquarie local government area, and 1 in the Newcastle local government area. In the Illawarra, again, numbers are rising and are of concern. 22 new cases, 15 cases in the Wollongong local government area, and 7 cases in the Shell Harbour local government area. I want to have another call out to the Committee of Walker. The week ending Friday. They've moved to 83.9% first dose and 54% second dose. So really a mighty effort from a regional community like Walker. And Edward River, 72.4% single dose and 46.9% double dose. And to the community of Dubbo, who are at the heart and at the centre of the outbreak, can I say thank you for coming out. We've seen a movement there from first doses from 35% to 69%. Now, since 8 p.m. last night, in the southern part of New South Wales, and Dr. Kerry Chan touched on the sewage detection, there has been 2 new cases notified this morning for Queanbeyan, but luckily no exposure sites. They are linked to the Canberra outbreak. Again, to the clear message to people in regional New South Wales, keep getting vaccinated.
What percentage of healthcare workers and quarantine workers have now been vaccinated? Because you're talking about the months ahead, what it will look like about opening up. But how is the vaccine looking for our frontline workers?
I answered this question yesterday, but the vast majority of all of our frontline workers are vaccinated. Well, yes, I said it yesterday. It was around 83% of frontline health workers have been fully vaccinated. But obviously, as new people come into the system, there's 140,000 at least. As new people come into the system, they're obviously supported through vaccination, and we have until the end of September to make that happen. But I did talk about that yesterday.
Regarding, you mentioned a couple of days ago LGAs of concern. Some LGAs could come out.
I'm sorry, I can't hear the question.
The LGAs of concern.
Yeah.
You mentioned some were looking good and they could
Yeah.
come out. Burwood hasn't had many cases. What's happening with Burwood? When will
Well,
you bring it out?
In fact, our public health team are looking at those numbers closely, and now that we've hit 70% first dose vaccination, it gives us opportunities to look at those things, including whether some local government areas of concern can be relieved of being under that consideration.
Just to follow up, you keep saying that the public health team is looking at it. That's great. But when will these areas of great concern have more of a substantial roadmap to what will allow them to come out of that list?
The bottom line is when it's safe to do so, and you don't only look at the number of cases in a particular location, but also where the movements are and where the cases are going. So we're looking at that on a daily basis. The public health team provides me with that information on a daily basis, and we're obviously looking to provide further relief for those local government areas of concern. We do note, however, regrettably, that between 70 and 80% of all cases are still coming from those areas. However, there are some councils we're looking at to see if we can relieve them of those burdens, or even part of councils, and that's ongoing work. But now that we've hit the 70% first dose across the state, we do have some greater flexibility at looking at how we can ease the burden of our citizens, and that's why I was very pleased to announce just a few minutes ago that all those local government areas of concern will now have the same rule to exercise apply to them. That is unlimited exercise between 5 a.m. and 9 p.m, which I hope will be received as a welcome relief for many families who live in households with a number of children in particular.
Regarding the freedoms when we reach 70% for the fully vaccinated, what will happen to people who've had COVID recently and have been told by doctors, for instance, they can't have the vaccination maybe for 2 or 3 months? Where do they fall in then that system?
Well, look, I will take the public health advice on that, and I might ask Dr. Chant to make a quick comment about that before I take further questions.
So clearly the advice is that within 6 weeks of an infection you're unlikely to get reinfected with Delta, but actually natural immunity to Delta or any of the viruses is less effective than actually the vaccine in terms of providing long-term immunity. So what we would be suggesting is that we will probably have to work up a system where people can indicate that they've had recent COVID, and that would be developed into our thinking. But there may be certain circumstances where people are in high-risk industries or high-risk settings where we have a clinical discussion with them and actually offer the vaccine to those individuals as well. So it's not a cut and dry, it is a general guidance, and we base that on the ATAGI advice.
Can I ask about ivermectin? We had a person present to hospital after having what seems to be an overdose or too much ivermectin as a result of a misunderstanding. They think that they can take this drug to treat COVID. They were COVID positive. Can you just talk to us about the risks of using unproven treatments in treating COVID and the message to people?
I mean, my message would be simple for all things. Make sure that you've getting your healthcare provided by a healthcare practitioner, and that you seek advice before taking any medications. It is important to seek the best health advice. Our doctors in Australia are across the literature in terms of what drugs and therapies are useful in COVID, so please listen to them.
We've been hearing a lot lately about one day learning to live with this virus. So I'm wondering, at what point does the pandemic end and COVID-19 becomes endemic?
I think that's the reality that most of the world has been confronting. What we're really pleased to say is we've got great vaccines, and I think I've indicated before that we will be getting vaccinated regularly. There will be new strains that emerge potentially, and we'll have boosters, a bit like seasonal flu. So every year in seasonal flu, they try and predict which strains are the predominating strains, and we have a vaccine. What's really useful is some of the technology. We've made vaccines quicker than we've ever made them before, and so some of the mRNA technology gives us hope that we'll be able to rapidly accommodate to any changes in the virus. But that's where we're going to be, and the key message is we need to get that second dose protection. So whilst I'm very pleased we are at 70% first dose, as you know, I've previously said I want to see the sky as a limit. I think Australia can be the most vaccinated country in the world because we believe in science and we believe in vaccines. But what I also need to do is get that second dose into people, because 2 doses protects.
Given the deaths of 2 fully vaccinated, I think by this update, 2 fully vaccinated people, how difficult does that become then to present that message, particularly to older people, to get the jab?
I think it's very clear. The data is so clear. Can I just reflect on our experience with aged care facilities that we've had now compared to our first wave of infection? We've had many aged care residents admitted to hospital, but that's often been for monitoring. And we've had many aged care residents who are double vaccinated, who have had very, very mild COVID and sometimes minimal, if any, symptoms. And I can't stress enough, when you have COVID, you will see, when the majority of the population is vaccinated, the cases of COVID that you see will occur more in vaccinated people, because of that no vaccine is perfect. But we know that they are very effective, and I couldn't stress, when I look at the data on the immunisation coverage and see that we still have some 70 plus population in New South Wales that are not fully vaccinated, we still have some 50 plus people that haven't come forward for their vaccination. That's what concerns me, because we will see the deaths more likely in those population groups.
Just on testing, you mentioned antigen testing being something that could be useful in, for example, critical industries, prisons or whatever. What about schools? Would antigen testing in a school setting, where you can screen kids and teachers and staff, would that be useful in making that setting more safe?
We're looking at the full array as we work through. At the moment, the school settings, we're working with education on what that looks like. But clearly we will look at all technologies and how they've been applied. You're probably aware that in other countries they've used rat testing. So just be reassured that we're looking at all of the different technologies and how they can be implemented. But a key strategy we have available is also vaccine, with the approval of the vaccine for 12 and above. And as vaccine becomes available, then that's a very good risk mitigant as well.
Dr. Chen, how does the process work when somebody has had COVID, say a household, and they've then passed 14 days and they feel they've recovered? What's the process of notification from New South Wales Health? Because we've heard about whole households where 1 or 2 people in the household have been told by New South Wales Health they're free to go after 14 days, but other people are left waiting and they're not given any answer.
So our clinical teams have had to scale given the high case numbers, and so the systems have been refined and put in place. The clinical teams will assess whether someone is symptom-free at 14 days. So there is a guideline that's developed by the Communicable Diseases Network of Australia that outlines the release criterion, and if you aren't immunosuppressed, if you haven't got ongoing symptoms, then you are released. And we're streamlining those processes. So can I genuinely apologise for, I'm aware of a few cases that have been raised where people are sitting at day 15 or day 16 and haven't got symptoms. Those clinical teams are getting to you, and we're trying to make sure that we have cleared everyone appropriately.
Dr. Chan, we keep hearing from ICU nurses that are really expressing concern about the weeks ahead and what they call really a staffing crisis. So while we may have quadrupled ventilators, we haven't necessarily quadrupled staff to account for that. Are you confident that the staffing system is going to hold up? And are we seeking other workforce from other parts of Australia or abroad? What are we doing to address that?
I think the issue is, first I'd start that question by what can we do to prevent that? So we can prevent cases in the future. We can't prevent the cases in the past, but we can prevent the cases into the future by taking up vaccination and making sure we follow the rules and we cooperate fully with contact tracers and the other public health requirements. In terms of clearly our ICU capacity is something we're looking at closely. There have been well-developed plans for what sort of surge staffing, and there has been a lot of retraining of different staff throughout the pandemic in planning for a rise in cases that need intensive care.
How many ICU nurses do we have then available, and how many do we have that have been retrained, added to that?
I haven't got that data with me for this press conference, but clearly we are looking at all of the different elements that make up an ICU. And I think a few days ago we had an intensive care doctor speak to us and an intensive care nurse, and they talked about the very team approach, that you need wardsmen, you need nurses that can manage the ventilated patients, and physiotherapists, other people that provide care. So all of that work has been done many months ago, 18 months ago, and it will continue to be refined. So the community should be reassured that we have a very networked system. But is it hard? When I heard how hard our intensive care and intensive care nurses and our staff in intensive care are working, of course we want to prevent those cases going to intensive care, and that's why I would urge you, please get vaccinated.
So you've told us how many people are in hospital with COVID. How many are in the health hotels, or how many are actually at home with COVID? And what's the protocols as to whether somebody goes to a health hotel or can stay at home?
So the health hotels are prioritised for those people that can't safely isolate, or where there's vulnerable people in the household. So we have those health hotels, and we have a prioritisation criteria for getting into the health hotels. And tragically, we have to. Many people don't have. We've got people that are homeless in our society. We've got people that maybe share a small apartment. Things that clearly are not safe in the context of COVID. So those individuals are prioritised for admission, and certainly also if they're very vulnerable and can't care for themselves, they're also prioritised. The way that our clinical services are provided is that we segregate our cases by the risk. So younger people, people that don't have underlying medical conditions get followed up, and then there's more intensive work done for those that are potentially older or people that have underlying health conditions. So our clinical teams very much make those decisions, but we have well-developed systems now for making sure that we've got that contact with individuals, be they low risk, because even low risk people can go on to have a deterioration, and that's why I think we've warned people before. Please, if your condition changes, do not hesitate in bringing it to the attention of your health team.
Sorry, do you have a breakdown though of the numbers as to how many people are in the health hotels and how many people are isolated with COVID at home?
We certainly could give you those numbers, and those numbers are very fluid. They come in and out as we have people released from isolation at home. So be happy to follow up those numbers.
When will citizens be permitted to travel to regional New South Wales? Obviously not for essential work, which they can do now, but for leisure, holidays, to see family. Will that be at 70% or 80%?
Well, positively, they're the issues that we're discussing at the moment. So we're looking at all the things that we would love people to do at 70% double dose. And that's an option on the table. The Deputy Premier and I and the health team have actually been discussing this in the last 48 hours. So can I just confirm, following that question, the New South Wales Government, in conjunction with our health experts and agencies across the board, is working on finalising our roadmap on what 70% double dose looks like, what 80% double dose looks like. And we know that at 80% double dose, we have a keen eye about international travel, about welcoming home more Australians through Sydney Airport. We have to accept living with COVID is a reality. It's not an option. And any state premier who thinks it's an option, unfortunately, is not considering what the real world experience is. And the real world experience is all of us as Australians, no matter where we live at some time, it might not be today or next week, but all of us as Australians have to accept that living with COVID is the future. It's not an option. It's not an option that any of us like, but it's an option we have to confront, and it's an option we have to support our citizens work their way through. So in relation to when regional tourism and when tourism across the state can start taking shape, we're certainly looking at those options for 70% double dose, and we'll take the advice of the health experts.
The Queensland Premier has raised concerns about children when you open up at 70 and 80%, leaving children exposed. How concerned are you about that? And have you looked at modelling or looked to overseas to see what is happening in that aid?
Oh, look, certainly we're presented with information from our public health experts all the time. But as I said, there are only 2 places on the planet at the moment that have 80% double dose vaccination in their adult population. So if we get to that level, that is a huge achievement for Australia. And secondly, as you know, we will have an intensive program to vaccinate 12 to 15-year-olds. So every time you click over an extra percentage of people vaccinated, it protects those younger children. In fact, obviously serious disease can affect anybody of any age, but less so the younger somebody is, and that's what the health experts tell us all the time. But certainly we should all follow what the conventional advice is that's provided to us through highly reputable organisations like the Doherty Institute and like our federal and state medical officers, and the advice to us is what we can do clearly when 80% of the adult population is double dosed. But in New South Wales, we'll also be working, depending on the supply of vaccine, to vaccinate 12 to 15-year-olds, and that will give all of us, especially younger children, that added layer of protection.
Premier, you would have heard Premier about...
That's a question, yeah.
Premier, when we are looking at that 70 and 80% vaccination doses, are you going to be looking at that as a state figure, or will you be looking at it in areas of breakdown in terms of, if a certain area hasn't got to 70%, will it mean the whole state is still in less freedom?
Look, as much as possible, that's why, and the Deputy Premier certainly does this with the regions, we keep a keen eye on seeing how every local government area is doing, seeing how every part of our state is doing, and we would love to see the state move forward together. And generally speaking, most areas are. There are some that are doing very much above that and some that are doing below that, and if a particular area isn't doing as well as others, we ask why is that the case and what can we do to address that. So we're very much mindful that we want to bring the state forward together. We're very keen to make sure that when we provide opportunities for people that are vaccinated, it will be across the state for simplicity, but also in terms of the fact that when vaccinated people come together, the risk of getting COVID and spreading COVID vastly decreases. And we know from one shot you get protection, double dose you get extra protection, but when you have people coming together who are completely vaccinated, the risk of spreading disease and the risk of hospitalisation massively declines. So as much as possible, we'd like everybody to move forward together. We acknowledge that there are some communities that we have to put more concentrated effort into, and that's why it gives me great joy when we look at the local government areas of concern. Some of them had vaccination rates as low as 19% first dose, and now those same local government areas are 65% and higher, which is very encouraging. So we are working now because obviously hitting the double dose 70% we envisage will happen around mid-October. So we have between now and then to really focus on those communities who may not be travelling as well as others and really try and get that rate up as high as possible. But I'd love to see, once we get to 70% double dose during today, single dose during the day, as Dr. Chant has said, we're keeping a keen eye to see how quickly we can get to 80% first dose, because the more people that are vaccinated, at least with one dose, by the time we open up, gives everybody that extra layer of protection.
Premier, just on the 70% target, could I also I think it's a similar one to this. Yeah, I'm curious, are you going to be looking within the 70% and 80% for even higher rates among priority groups like 1A and 1B, older people, Indigenous communities, disability settings? Or is it the case that once we reach 70%, there's an assumption that everyone's had a chance?
We've already started the strategy to make sure we target those vulnerable communities the most. And when any of us see any person over the age of 70 in particular who isn't vaccinated, that is a huge concern. I'm 50, I've had AstraZeneca. There is no reason for anybody not to accept either vaccine. And I just urge people who are older, the statistics are the best source of truth. The statistics tell us that if you're double dose vaccinated, the chances of you getting into hospital or intensive care are much, much lower. But obviously those risks increase the older you are, whether you have an illness, whether you have a comorbidity. And what we do, of course, when we report the tragic deaths from COVID, we say someone who died with COVID, but sometimes people have underlying conditions or very serious illness, and that's why we're completely transparent. But we appreciate how strongly and how well the vaccines work. But in particular, we don't want to see anybody vulnerable not take the vaccine, because anyone who's unvaccinated is exposed as much now as they will be when we start opening up.
Are you satisfied that all those priority groups have had the chance to get it?
Well, obviously, the Commonwealth had responsibility for some of those priority groups, and we're addressing some of those challenges, as well as older Australians. But there is ample supply of AstraZeneca, so anybody should come forward and get vaccinated. We don't want to see anybody vulnerable without vaccine. Vaccines, I mean, this is, I've said a couple of times, really a pandemic and epidemic of the unvaccinated. When we do see people who are fully vaccinated hospitalised or horribly die, often there are other conditions associated with that. So let's be very clear. The evidence is quite stark. And I say to the other states, don't assume because you don't have cases today, you won't tomorrow, the day after. Get ready. Vaccinate your populations, get the intensive care capacity going as we've done, to make sure you can meet those challenges, because there is no way that Australia or parts of Australia will be COVID-free, especially once we hit those 70 and 80% double doses.
What motivated the decision to change the exercise rules in the LGAs, and what stopped you from going further, say removing the curfew?
Oh, certainly. Well, obviously we know that outdoor exercise, especially in those LGAs where they're households that are exercising, is very low risk of transmission. But obviously we ask people to make sure if you're coming into contact with other people, have your mask on to avoid that. And obviously health and wellbeing and mental health are very critical at this stage. And when our public health team gives us advice, government also needs to consider the broader health and wellbeing aspects, and it was a combination of health advice but also wellbeing. We want people to get fresh air, especially as the weather is warming up, and where we can, we want everybody in New South Wales to move forward together, and that's why I was very pleased to make that announcement. The other degree of confidence that it gives us is many of those local government areas of concern either have higher or close to 70% first dose, and that level of vaccine, whilst not foolproof because it's not double dose, it does give us some level of comfort that some proportion of the community is some way protected. So that is our thinking. As I've said, the most important figures that we're looking at on a day-to-day basis are the rate of vaccination and how many people regrettably have to be taken care of in intensive care, and they're the two numbers that we will continue to monitor on a daily basis. And obviously, as I said, serious illness tends to happen in the second week after someone's diagnosed, and that's why there's a lag, and that's why October is likely to be the worst month for the number of people, unfortunately, who die and the number of people that are in intensive care. And we're obviously continuing to address those issues. But as Dr. Chan and Minister Hazzard have said on a number of occasions, our pandemic plans have been in place for 18 months. Do we need to do things differently? Of course we do. It's a pandemic. Will the health system cope? Of course it will. Will it be stretched? Of course it will. And does our heart and minds every day go to those healthcare workers for whom every day is a stretch and a challenge? Absolutely. Treating people with COVID is extremely difficult, let alone having COVID and let alone being a loved one who can't visit your loved one because of COVID. So these are challenges everybody is going through on a day-to-day basis. And as we say, we know it's not any secret that the best way for us to cope in relation to our health system, but also in relation to serious illness and death, is vaccination.
You heard about the 3-year-old boy who was stuck in Griffith. Are you able to facilitate something with the Queensland Premier, get on the phone to her and ask her for some help?
Oh, look, it's always heartbreaking when we see so many examples every day, such as that one. And I just ask every state Premier to, as we do in New South Wales, and Minister Hazzard on a daily basis is making exemptions every day for people who are in dire situations. And I just ask everyone to consider those cases, consider those exemptions, and also to have a compassionate approach, because we know that living during a pandemic is difficult enough, but when families are torn apart and when children are separated from parents, it's especially difficult.
Will you call the Queensland Premier and ask her?
Yeah. Okay. But regrettably, whilst that case has been highlighted, there are hundreds and hundreds of other cases like that. And I just want to put that on the record that whilst we hear about these cases from time to time, there are hundreds and hundreds of cases like that every day. And that's why all of us, no matter which state we govern and what our circumstances are, all of us have to display a degree of compassion and understanding because perfection in a pandemic can never be achieved.
Premier, just on that, this morning Anastasia Palaszczuk has said that if the New South Wales model is what's going to be adopted, that there needs to be serious discussions. She's tweeting that the Doherty Institute predicts that even with 70% of the population vaccinated, 80 people will die each day 6 months after the outbreak. Is that your understanding of the Doherty Institute modelling?
I can't see what those, I don't want to comment specifically on those figures, but I will say this, that firstly, we have to accept we're in a pandemic, and of course reducing the mortality rate and increasing vaccination is key, but we also have to put things into perspective. The sad reality is, outside of a pandemic, we lose between 600 and 800 people every year to the flu. We have to put things into perspective. Nobody likes to talk about this because it's confronting, but we have to get back to living with life as normal as possible, knowing that COVID is amongst us. And the one positive thing that that comment and those numbers fail to accept is the Doherty report says in due course, when you're transitioning between 70% double dose and 80% double dose, as Dr. Chan and Minister Hazard and others have said on a number of occasions in addition to me, is that you start normalising living with COVID when you have high rates of vaccination, when you have lower rates of people going into hospital. The case numbers are less relevant, but you are going to have death. You have death from the flu. It's a tragedy. I was providing a supportive message to the Heart Disease Foundation the other day, and 50 people every day lose their lives to heart disease. Death is horrible, but we also need to put things into perspective, because at the moment there are 8 million citizens who don't have a choice in how they spend their free time, who don't have a choice about what they can do when they can leave their homes. That is no way to live. And Victoria's going through the same. And Victoria's had 6 major lockdowns. So life is difficult, and what we have to do is sensibly transition to what living with COVID is like. Generations earlier, our forefathers and foremothers would have had to have thought about how they lived with the flu, because flu used to kill, especially those vulnerable without the vaccine. So we have to get very real about what we're facing, and I know sometimes it's difficult to hear, and I remember specifically the day that I said we'd never get to COVID zero, but that's the reality. And what we need to do is live with COVID normal, and getting to 80% double dose adult population gets us on our way.
Follow up on that, Premier. The specific numbers, 80 people a day, each day, 6 months after the outbreak, 2,240 people dead in a month. That's what Anastasia Palaszczuk has tweeted. Are those numbers in the Doherty report? Because it sounds like asked about those numbers. You said
talks about
we need to take that in perspective.
Look, the Doherty report talks about those. The Doherty report is a public document, so everybody can read that document. But those numbers are across the nation. So if you look at the population of Queensland, you can then extrapolate what that means for Queensland or what it means for New South Wales. But if New South Wales has 600 to 800 people who die of the flu every year, if you extrapolate that across the nation and triple it, that's nearly 2,500 people across the nation who die of the flu every year. Now, I know this is a very difficult conversation to have, but this is what will get us through. This is the light at the end of the tunnel. It's accepting that COVID is part of our lives, accepting that unfortunately people will die, but they will less likely die if everyone is vaccinated. And this is the reality. And that's why, as New South Wales is the largest state, we've often had to lead the debate on this, and often when I've had to say something as a state leader, as difficult as it's been, it's to help all of us come together and manage the transition to living with COVID normal.
Deputy Premier.
Oh, can I ask Premier?
Deputy Premier.
Can I ask Premier one?
Oh, Premier, just a follow-up.
Okay, yeah.
Antigen tests and at-home tests, you've suggested that could be something that we use in the future. Would you like to see the restriction on the capacity to do at-home tests removed by the DGA?
I think
Should that be scrapped?
Yeah, the federal authorities are actually looking at that as we speak. So we're looking forward to that, because that will obviously assist us in the process. Obviously, PCR tests or the traditional tests people have are much more reliable, but in certain settings, rapid antigen tests, I think, is the way of the future. And I know that our regulatory authorities at a federal level are looking at that. And just to put things into perspective, New South Wales has recorded again around, I think it was 170,000 tests every day. I mean, we're doing nearly 1 million tests rates over 7 or 8 days, which is just incredible. But that is a huge burden on the system. And in the future, when you have high rates of vaccination, we'll be doing things differently, whether it's a home quarantine system or whether it's testing in certain settings, even at home. We're not there yet, but we're certainly getting there in terms of transition.
Deputy Premier, the hospitality industry made a proposal earlier this week about October long weekend being selected as a weekend to trial the reopening of hospitality in a particular LGA with low cases and high vaccination rates. Is that something that you would consider? And when are we expecting sort of the next steps in the roadmap?
Yeah, look, it's a good question, and we've engaged with the hospitality industry, the tourism industry, with industry in general. We reached out to myself and Minister Dominello, had initial talks last week. I know that the Treasurer and Minister Ayres are also engaging with industry, more engagement next week. We're not going to preempt when trials could possibly happen and what trials look like, more importantly, and we're not going to preempt what is happening at 70 or 80%. The Premier has tasked myself and a number of ministers to get on with finalising the roadmap. We're doing that as we speak. We're going to engage with health shortly, and hopefully the government will have something to say in the week ahead. So the reality is that we want that engagement by industry. The only success that we'll get through this is where industry buys in to the concept that their staff, everybody that is working on a premises is vaccinated, doubly vaccinated, and then their patrons will be vaccinated. And we want that to be the model. And the engagement with industry, it's good to see they're coming forward with plans, but we'll have some certain principles within the roadmap that talk about the safety net, to the point that the Premier keeps touching on, that yes, there will be a level of freedoms, but there's also going to be a level of restrictions to make sure we do this in a managed way and minimise the stress on the health system.
For Sydney-siders who wish to travel to country New South Wales to be double vaccinated once the state opens up to protect those vulnerable communities from transmission? Yeah,
look, the Premier has already touched on that. We're having a consideration about regional travel, how Metro or Greater Sydney engages with regional rural New South Wales. We'll be looking at the data there to make sure we protect those vulnerable communities, our regional and rural communities. But why wouldn't it be a double vaccination? If that's what we're talking about, if the end game is everyone to be vaccinated, that is something that we'll put into consideration, and we'll have more to say about it when we announce the roadmap.
There's a huge concern at the Liverpool hospital that patients are now having to be transferred out and some being turned away because of the COVID overcrowding or overburden on that hospital. Similar thing happened with Westmead last week. When we hear that hospitalisation rates and ICU rates are going to get worse come October, how is the health system going to cope then if it's on its knees now?
It's not. The health system in New South Wales is world class, and I want to thank the doctors, the nurses, all of the staff in the hospitals that are looking after our patients. But obviously, as I've said numerous times, the hospitals work in a network. We had the ICU specialists, I think two ICUs, one emergency department and one ICU specialist here in the last week have both pointed out that the entire system works as a network, and transferring patients from time to time from one section in a hospital to a similar section in another hospital is entirely normal. So, and that's not to understate the pressure that our hospitals are under, and that I think emphasises the point that we all have a responsibility to go and get vaccinated. Each of the doctors who've come before this press conference in the last 2 weeks have stressed that we all have an obligation to go and get vaccinated. Yesterday we were told not to listen to social media by people who are not qualified in anything except hiding behind a keyboard. The short answer here is science and medicine tells us that we need to get vaccinated. I mean, sometimes when I hear what's going on social media, it's like the days of the bubonic plague, the Dark Ages, 1348. We still expect that we won't have vaccines. Well, we have got vaccines. We're not in the Dark Ages, and some of these people who are out as keyboard warriors, hiding behind their screens and scaring others into not being vaccinated, are really quite irresponsible. So listen to the science, listen to the doctors, get vaccinated, and you will be doing yourself, your community, your nation a favour.
Yes. Nursing students are having their placements delayed or cancelled. Obviously, we're trying to get as many nurses into the system. Can we do something to prevent aged care facilities and hospitals from cancelling these important placements?
Obviously, the placements are being determined in a clinical sense as to where is appropriate. My understanding is that we're actually welcoming new nurses and students into our hospitals, but obviously there's some requirements around being vaccinated, so I expect that will continue in a sensible way. I think you asked a bit earlier about the health hotels. Yeah. Look, as at this morning, my advice was there was almost 900 people in our health hotels, and around about 690 of those were positive.
The Premier talked about the health system's gearing up for a surge in cases. Are you concerned that it's going to get to a point where there'll be an ICU situation in triage in terms of probability of survival? Do you think we would ever get to that point?
Can I say that doctors, from the moment they're trained at university, are trained to understand that there will be times when they have to make professional decisions. That's not unusual. And the simple fact at the moment is that the ICU specialists deal with these sorts of issues, life and death issues, daily, and depending on the circumstances. So I have my faith completely in those doctors making sensible and rational decisions.
Just firstly, is there any progress on the Queensland border bubble at all, as far as you're aware?
Look, I hope the Queensland Government gives consideration to the fact that in northern New South Wales we've had barely any cases for months and months. So I think we have to recognise that border communities do live as one, and any consideration the Queensland Government can give to allowing, and I understand southeast Queenslanders are just as frustrated as people in northern New South Wales. But any notion that we're going to change the state borders doesn't work. However, I will say to the Queensland Government, please consider the risk, please consider the fact that there are still no cases in northern New South Wales, and especially in communities who've functioned as one for generations. Just show that level of compassion and also, I guess, pragmatism.
And I appreciate this is a federal matter largely, but there are Australians, quite a lot of them, stuck in the southern island of New Zealand where there are 0 cases. They can't return to Australia. Do you have a level of sympathy for them? Would you say anything to the federal government in regards to that?
Absolutely. And New South Wales has taken a pause on the number of people we normally bring in. We're still bringing more than any other state, from what I understand. But once we get to 80% double dose, I want to really make this clear. New South Wales will have a very compassionate approach to all Australians. Every state has a different way of chipping in to the pandemic, chipping in to how we can support our fellow citizens getting through this. And once 80% of our population has double vaccine, I want Sydney to be welcoming to all Australians who are stranded, some of whom have been waiting months and months to come home. And that is something I think New South Wales can do to support other states, and I hope that all states pull together and stick to our national plan, because eventually every state will have to deal with living with COVID, and some earlier than others, and you'd expect the largest state with the largest airport and the largest number of people coming through the nation would have to go through this process first. But as we've seen in other states, the experience of other states, Delta is a game changer. But it's also a positive way to look at us living or seeing how we can get through this and living with COVID post that 80% double dose.
Dr. Chan, state premiers, that perhaps you're looking too far ahead. There's such a focus coming from what you're saying on the 70% and 80%. We're in a crisis still right now, and there's still another month of lockdown to go, that you're not focused enough on the immediate situation.
No, a good government focuses on the day-to-day, but also has an eye to the future. And all of you here present in particular, as well as those at home, would know how confronting the conversation's been about living with COVID, about what we need to do to get to that safer place. And that's why I think any time that we have information, it's important to convey that to the community. The community has a right to know what's coming up, as well as how we're dealing with things day to day. And I will always commit to doing that. Giving bad news or confronting news is always difficult, but so is giving positive news, because there is always a positive light at the end of the tunnel. That phrase has been thrown around a lot the last few weeks, but with good reason. Who would have thought? I mean, the vaccination rates in New South Wales, and with good cause, we have a major outbreak, but the vaccination rates in New South Wales are some of the highest anywhere on the planet has seen. From getting our population down from 19 or 20% first dose, and supplies being constrained. But the public are with us, and the public have been amazing. And this is what we need to continue, because unlike other places around the world, we will have a measured and planned opening up. Most places around the world haven't done that degree of measured and planning in opening up. They've kind of let things go, which we won't do. We'll make sure that every time there's a milestone, we do things safely and bringing everybody together. And that's why it's really important to have those conversations. 4 weeks or 5 weeks will be here before we know it. And it's just about preparing the population. But I don't want anybody waking up the day that New South Wales hits 70% double dose and saying, oh, gee, I'm missing out. Well, you will be missing out if you don't get yourself vaccinated. So giving people that time allows that to happen. Last question.
Just on the borders, sorry, Premier, because there is still a situation where Victoria is going to reach their vaccine milestones similar time to us. He's saying, Dan Andrews is saying 2022, the border won't be open this year. We've got this situation in Queensland. The other states, everyone is closed to us. Do you think it's time for the Prime Minister to up his rhetoric on the states regarding interstate borders, because we are talking about international borders before we even talk about interstate borders? Would you like to see the Prime Minister step in and try and put some pressure on those premiers?
I think the Prime Minister's been very clear in encouraging all of us to stick to the national plan, and New South Wales intends to do that. We've been very clear on that. And just as people like to think that they can live in a COVID-0 world, eventually that's not going to happen. I don't know to what extent citizens in other states will put up with living in a bubble. Not forever. There has to come a time when we all realise that we have to accept the confrontation of living with COVID. And I make this point. Previously, other states would close to us when we had 1 case or 2 cases. That is not living in the real world. What is living in the real world is knowing what is a safe way to reopen, what is a safe way to reconnect as Australians, but also with other countries. And we have to walk that line in a safe way. And I just ask everybody to stick to the plan. The plan is solid. It's based on science. And I can't control what other state premiers do, but I would just urge everybody to sign up or to commit to the plan that all of us signed up to. Oh, sorry, very, very last question. It's been last question for a few questions, yeah.
On the freedoms people can accept if they're vaccinated at 70%, what happens to people who've been vaccinated overseas, like in the US with Johnson & Johnson? Will they be eligible, and how do they prove it?
So we anticipate the federal authorities will give us a list of vaccines which are regarded as safe for people to be vaccinated. So New South Wales will obviously honour that. We look forward to that list obviously coming out in due course, but there are some vaccines who obviously have very high efficacy, like the ones we have available in Australia. Other vaccines around the world don't have as much efficacy, so we'll make sure that whatever the federal authorities announce, we stick to when we're welcoming home Australians, especially those who obviously want to come home and look forward to home quarantining rather than being in a hotel. And those opportunities will be available if they're double dose vaccinated with a vaccine which the federal authorities in Australia regard as having high efficacy. Thank you, everybody. See you tomorrow. Thank you.